Hello, today we are going to be doing a ACE wrist Volar splint. So we are going to use a 2-inch ACE wrap, a 3-inch ACE wrap, and fiberglass. So the reason why you do a wrist split in the first place is to, one, secure the wound. So if you have the bone, tendon, ligament, you want to keep them in place so they heal properly. Two, you want to prevent further injury. You don't want to leave the injury exposed. That could lead to more complications if you, for example, hit it again. Three, of course, the patient is in a lot of pain and may be experiencing inflammation, so protecting it with a covering is going to alleviate some of that pain as well. So, three things that a patient should do when they go home after they're discharged from this appointment getting the cast is they should not shower with the cast exposed because that could lead to like an infection if water gets on it. They could use a plastic bag or get like a specific covering that's made of plastic for the casts as well online, and that could just help them bathe, shower. Two, they could move their fingers throughout the day when they are in the cast to prevent them from getting like their circulation blocked. Three, if they are, especially the first 48 hours after they get the cast, they should keep it in this position above their heart. That's to prevent inflammation, and really afterwards as much as they can throughout the day as well when they're resting, to keep it like in that position, not lower. Three things that they should immediately go to the emergency room for is if they obviously broke the cast or it slipped off, so they can get it fixed. If they have any paleness or blue discoloration in their fingers or any numbness or paresthesia, then that could be indicative of some serious conditions from this, so they need to go to the emergency room right away. And three is if they're experiencing extreme pain and they're taking their pain medications or any over the counter medications that they're allowed to, and the pain is not subsiding, that could be indicative of serious complications as well. So now that we've covered all of those basics about Volar wrist splints, we can get started with our procedures. So we have our patient here today, and we are gonna start by, I already measured the fiberglass from the MPCs of the patient in their plantar flexure position all the way down to about 2/3 of their arm. So we can place that in that location. So again, at the MCPs, and I'm gonna have the patient kind of hold it down for me there. Yep, right there with our other hand. Then I'm gonna start with my 2-inch ACE wrap first, and I'm gonna come around and I'm gonna secure from the bottom. And at this point, I'm gonna make sure that I only touch the patient's injury location with the ACE wrap and not my hands, because if I touch it with my hands, then I'm going to possibly cause further complications to their injury, so we don't want that. So you can let go now. So the patient has let go now as I've secured the ACE wrap at the location of the injury, and we're gonna work our way distally first, and we're going to do this because you're gonna make our way to the first white space. Okay, so your body. And then I'm actually gonna come around again and make sure I go through the last space one more time just to make sure that I have secured the patient. And then we're going to start working our way proximally after we feel that we have secured them. And we're going to wrap about 50% as we go. We're just going to make sure that we use this as we go. So now that we've made it about 50%, we're going to go in with the 3-inch one. Okay, so now that we've secured this about 50% of the way down, we're going to go in with the 3-inch wrap, and then we are going to just secure all the way to the bottom. And again, we're doing 50% coverage as we go around. And when we finish the 2/3 of the way with the 2-inch ace wrap, I forgot to mention before, but you have to make sure that you finish on the side of the fiberglass, which we did. Okay, so now that we've come to where it goes, and we secured it with tape. We can work our way up and add a little bit more because it doesn't seem like it's 50%. So you want to make sure that it's really secure. Okay, so now I'm going to have the patient put their arm in a resting position this way, and I'm going to make sure that they are able to flex their wrist at a slightly dorsal angulation, and they have normal flexion of their fingers. And I'm going to make sure that they don't have any pallor or any numbness or paresthesia, and then I'm also going to make sure that they stay in this position for at least 10 minutes before discharging them. And that is the procedure.